Happy Wednesday to everyone. We want to welcome you to our Emory University Cognitive Neurology and Integrated Memory Care Clinic Dementia Lecture Series, webinar series. Glad to have everyone here today. My name is Ashley Varner. I'm a clinical social worker in the Cognitive Neurology program at Emory. My colleagues are here today, Alice Cooper, my social work colleagues, Alice Cooper and Laura Metters. And we are really pleased that all of you are joining with us. We hope that you will share with us. This is our second of the lecture series. We're meeting monthly. We're offering these webinars monthly. If you have particular topics that you're interested in, please let us know. We aim to please. And really this series is to get information out for y'all, to get really good information out for y'all. Today we have Michelle Allen, who is a long time social worker. She's been working in geriatric social work for 18 years now, and is one of our favorite people to work with, and is a geriatric care manager, super skilled. So she's going to talk to us today about what is geriatric care management, which is, I think, an important thing for folks who are on the mild cognitive impairment dementia journey, to just know that it exists, and what's involved in accessing it. Guys, what have I forgotten? Oh, if you have questions along the way, you'll see down at the bottom a Q&A, and you can type your questions in there. We can see those, and we will be answering them as answering fits into Michelle's talk. You will not be able to see each other's questions. Okay, now what have I forgotten, y'all? Anything? All right, well, Michelle, take it away.
Well, thank you all for letting me join you today. I'm very passionate, of course, about geriatric care management, and very excited to be here to talk to you all about it. Now, in an ideal world, right, we wouldn't have geriatric care managers. In an ideal world, like, the aging issues wouldn't be this complex, and the long-term care world would not be this difficult to navigate, that you would ever need a professional to help you through it. But that's not the realities that we have. So I'm so grateful to get to do this work with my families and to be doing geriatric care management. So what is geriatric care management? So it's defined as a health and human services specialist who acts as a guide and advocate for families who are caring for older relatives and disabled adults. Well, that just sounds like a lot of gobbledygook, but I'll get into that a little bit more about how to understand exactly what a geriatric care manager is. The second bullet point just highlights that a care manager could have a background in counseling, gerontology, mental health, nursing, occupational therapy, physical therapy, psychology, or social work. My particular background is as a social worker. I'm a licensed clinical social worker, but there are a number of geriatric care managers who are nurses, a number who have a gerontology certificate or degree, and just have that specialized body of knowledge. So when you are thinking about ever working with a geriatric care manager, and we'll talk more about that later, it's good to think about what your needs are, and does their training experience, does their background line up with that? But in general, a geriatric care manager is somebody who specializes in working with older adults that can come alongside the older adult or disabled adult and their family or support system and provide some extra guidance, counseling, etc. So what exactly does a geriatric care manager do? What kind of services do they provide? And here's a list of services: advocacy, assessment, care management, crisis intervention, caregiver coaching, education, financial and legal issues, family meetings, information, move management, placement, referrals, travel, blah, blah. So there's all these, there's this laundry list of services that we can do. But the way to think about a geriatric care manager, the way that I describe it to families who ever contact me, is I just say, imagine what It's almost like imagining what an adult child, or especially an adult daughter who's very specialized in this program or in these issues can come alongside and kind of do for their aging parent or their older adult in their life that they're taking care of. Basically what a geriatric care manager can do. There's not a lot of boundaries around what we can and can't do for our clients. And we can do as little as just provide assessments and then offer recommendations, referrals, build a plan of care, build that roadmap, and then help the families navigate through that roadmap. Or what we can do is actually do a lot of the hands-on services. Again, I still feel like I'm being very vague, so let's talk about some more in depth. So a geriatric care manager, one of the big things that we do is provide an assessment and referral. So we provide comprehensive assessments on the physical, caregiving, medical, housing, financial, legal, and social needs of each of our clients, and then provide appropriate referrals to agencies and other programs in the area. So we're a specialist not only in understanding how to do the assessment on an older person or a disabled adult, but we're also specialists in what are the programs and resources and who should we be connecting our clients with out in the community. So we do the assessment and then also offer referrals, and then help the family create a plan for current as well as future needs. So that's a large part of what families call us to do, is just to sit down and say, okay, we've got all the right support system, we've got everything that we need, but we don't have the right information on what we should be doing next. And so can you help us build that roadmap? Can you help us understand what we should be doing right now and what we should be doing now to plan for the future? And so we can offer those kinds of assessments and referrals to adults and their families. Can also offer care management. And what exactly does that mean? So one of the things we do for our clients is actually attend doctor's appointments with them. So we can be that care manager that goes alongside each of our clients and the families maybe to each of the doctor's appointments and help understand what's being said in the doctor's appointments, what are the follow-up things that should be happening, how do we make sure that those changes and those recommendations from the physicians are being implemented and followed. We can also help facilitate communication between the doctor and the client and the family, making sure that everybody's on the same page, and then help determine what types of services, such as home health or hospice, that are right for the client, and assist in engaging and monitoring those services. So the care manager and the patient can be alongside each other as we go out on all the different spokes on that wheel that you see on the slide in front of us. So we can help communicate with the hospital, with the long-term care team, the community supports, home health, palliative care, everybody else that's a part of the care team. So we're making sure that people are all connected and working together. And along with that, of course, comes advocacy, right? So making sure that each of the providers that are on that spoke are doing what they said that they were going to do, and making sure that we're employing best practices and advocating for each of our clients that they do engage in best practices, and that we get for our clients everything that they have been promised and that they need. Another thing that we do, that geriatric care managers do for their clients, is address financial and legal issues. So we are not elder law attorneys and we are not financial planners, and we don't try to take the place of financial planners or elder law attorneys. But what we do is make sure that the legal issues as well as the financial issues are being appropriately addressed. So if our clients, assessing whether or not the clients have an advance directive, making sure the clients have a power of attorney. And if they do have those documents in place, do they still reflect what the current wishes are? Have they been updated recently? Can we find those documents? Are they accessible, and do all the right people know about them? And then on the financial side, we try to connect each of our clients with any programs that they might be entitled to that they didn't know about, as well as make sure that, if they're eligible for VA benefits, have we done all the planning to get them connected with VA benefits? And then are we looking ahead for Medicaid? You know, is Medicaid something at some point that we might need to tap into? And have we done all the appropriate planning to put that within reach should we ever need it? And so kind of walking through that. You'll see at the top of the list too, it says review or oversee bill paying. A lot of our clients who have mild cognitive impairment or mild and moderate dementia are still involved in their own bill paying, and they want to be. It's something they've done for decades, so it's something they want to keep doing, but maybe they need a little bit of support with that. And so we can help them sort through their mail and actually make sure that all of their bills are being paid, and not take that over for our client, but just oversee it alongside of our clients. So that's something that we can do with each of our clients. Along with that too, which is not on here, we're also looking out for any scams or any financial liabilities or fraudulent things that are happening, and making sure that safeguards are put in place so that our clients cannot be taken advantage of, and make sure that we're minimizing any risk of them losing a great deal of their finances to scammers or to people who've been exploiting them. And so that's something we're always keeping our eyes on and putting safeguards in place so that we can address, while still maintaining as much autonomy and self-direction for the client as we can, but taking a look at that. And then the last thing you'll see on the list is help clients and families with insurance concerns, claims, and applications. So like right now we're in a special enrollment period for Medicare, I think because of the COVID stuff. And so that ends March 31st. And that's something that a lot of our clients didn't know about, and we've been able to take advantage of a couple of times already this month. And so knowing about those kinds of things and helping each of our clients make changes to their health insurance as they need to, or doing things like filing the long-term care insurance claims, right? So if our client does have a long-term care insurance policy and it's time for us to activate that, make sure that we've got that going and actually helping them to put that into place. Crisis intervention. Another thing that geriatric care managers do is help clients navigate through emergency departments, hospitalizations, rehab stays, discharges from hospitals. A number of clients in the last 4 months have come to me right as they're discharging from the hospital. And they said, you know, things were fine at home. Now we've, unfortunately, a number of them have had COVID, recovering from COVID, you know, survived COVID, recovering from COVID, but now everything's changed. Like we can't go back to home the way it was before. The hospital discharge planners and case managers have been great, but there's only so much that they can do and help us piecing together this plan for home. Can you help us with this? And so I've been stepping in and helping them piece together the right discharge plan and how to get set up at home so we can minimize the chance that they're going to have to bounce back to the hospital or that they're going to get worse once they get back home. So there are a number of geriatric care managers that can step in and help right with that level of crisis. For our clients who have been with us for quite a while, of course, the other thing that we do for them and for their families is be that person who can go with them to the hospital or to the emergency department and intervene with whatever crisis is happening. So you'll see the last bullet point on this page is provide a much needed 24/7 emergency contact. So especially for families that live at a distance or for individuals who don't have an advocate or healthcare agent. And so one of the things that geriatric care managers can do as well is be that emergency contact. You know, so for my clients, I'm essentially on call 24/7 for them. In case anything happens, they come up and they need an advocate to go with them to the hospital or to be, you know, and I know that COVID restrictions right now are keeping us out of the hospital in most cases, but at least somebody to engage with the hospital staff, speak on their behalf. And occasionally over the last 10 months, we've been able to actually go with our clients into the hospital. I'm thinking about specifically a client who's hard of hearing and had dementia, but was able to engage with their geriatric care manager. The hospital staff was like, yes, please come in, like we need your help and support, and being able to communicate effectively with this older adult and make sure that we're providing the right level of care. And so being able to provide that level of support. Over the last 5 years, of course, we've noticed an increase in the number of folks who are aging without any family or other intensive support system. So they're kind of aging alone and then facing a mild cognitive impairment or mild dementia diagnosis and feeling very vulnerable and alone. So one of the options for an adult who's aging in that kind of situation is to have a geriatric care manager become the healthcare agent. So an older adult has anybody over the age of 18, right, can sign a Georgia Advanced Directive for Healthcare, naming somebody to be their healthcare agent. So the Advanced Directive says, if I'm no longer able to speak for myself, I would like this person to speak for me when it comes to my healthcare decisions. And there are a number of geriatric care managers who are willing to be that healthcare agent. So, I have one client who's designated me as their healthcare agent. Most of my other clients, of course, have family that are the healthcare agent, but that's something that geriatric care managers can do for clients, is actually be their healthcare agent. The other services, we talked a little bit about advocacy, but like I said, because we're specialists in the field, we know what should be happening for our older adults and for our clients. And so making sure that that is happening, and if it's not, who to complain to, who to send our concerns to and get them the right level of care. We also do caregiver coaching. So I have a number of clients that I just meet with the families and help them be the best caregiver they can be, right? So that's making sure that they're engaging in self-care, troubleshooting any issues that are coming up with safety, all the caregiver issues that come up, making sure that they're aware of like how the disease is progressing and what we need to be planning for. But my role is more of like as a consultation with those kinds of families instead of a hands-on geriatric care manager. Also providing education. We do facilitate family meetings. So I don't know if any of you guys have experienced this yet, but sometimes when it comes to caregiving, not everybody who's in the family agrees on how things should be handled. So the older adult, him or herself, has an opinion. The spouse might have an opinion. The adult children might have an opinion. There might be siblings of the older adults who have opinions, and not everybody's on the same page. And sometimes that can cause a lot of friction. So one of the things that we do for our clients too is actually facilitate family meetings where we can sit down together, talk about what the issues are, talk about the concerns, discuss options, and try to work together to come up with a good plan. As I talked about previously, we can be a client's healthcare agent. So, the power of attorney for healthcare can be signed, giving us that role as the client's healthcare agent. We just provide information and referrals. We also can help with move management. So we have a number of clients who are either moving from out of state to here or from here to out of state. And so we can help with those kind of big moves as well as smaller moves within the community. So if somebody's living at home alone, but it's time that, a lot of people on their support team think it's time for them to move into an independent living community, personal care home, assisted living community, we can help with those discussions and help with, trying to figure out the right next step and put that plan into place. We also offer travel coordination and companionship. So a lot of geriatric care managers can be hired to actually take an older adult. Recently, the only time somebody's been traveling is just to actually go relocate somewhere else. And so if a person is physically able to be on an airplane, but they just need a companion to go with them, hiring a geriatric care manager who is skilled in this area, able to problem solve, knows about dementia especially, and be able to help navigate and problem solve through that transition and through that transport is something that you can look to a geriatric care manager to do. So a geriatric care manager that I know is talking about, she's got a client who's relocating to Boston. It's going to be a great move. It's going to put her closer to her daughter. And the geriatric care manager is actually going to go with her from Atlanta to Boston, help get her settled in, and then come back to Atlanta. So you can have those kinds of coordination and companionship from a geriatric care manager. Like I said previously, it's hard to describe what a geriatric care manager does because there's not really a lot of boundaries around it, right? That we can do for each of our clients, whatever needs to be done. And, it's very similar to what a family member can do for their aging loved one. Here's a good question. How do I find a geriatric care manager? Well, there is an association that many of us are members of. So there's an association called the Aging Life Care Association, and they have a website that you can go to and click on their button that says "Find an Aging Life Care Expert." And once you go there, you can search the area and look at the person that look at all of the care managers who are associated with the Aging Life Care Association, and it tells about their credentials as well as links to their website so you can read more about them. We are very fortunate in Atlanta that our community is filled with really, really great aging life care experts. So if you go in there and search in Atlanta, you can find a number of great geriatric care managers that work in the field, and we're very lucky. Because I do often get requests for like, how do I find a you, but in, Southern Alabama, and you look and there's, nobody around for the next 75 miles. So there are some communities where the choices are very limited. We're all very fortunate that there's a number of great geriatric care managers here in the Atlanta area. Now, not all geriatric care managers are members of the Aging Life Care Association. Many are, but not all of them are. So the other thing you might want to do is ask your current providers. So if you are working with a primary care physician or a social worker in another capacity, or if you have the number to your area agency on aging, ask them, say, I'm looking for a geriatric care manager. Do you have anybody that you recommend? And you can find a geriatric care manager that way as well. Our geriatric care manager is certified. So as I said in the beginning, a geriatric care manager can have any kind of background, right? So like I happen to be a licensed clinical social worker. You could have a registered nurse. You could have somebody who has no license credential outside of being a certified care manager. And there is a certification for care managers. They are certified through either the NASW, so the National Association of Social Workers, or they're certified through the Commission for Care Manager Certification, the CCMC, or through the National Academy of Certified Case Managers, the NACCM. So you want to look for those designations whenever you're hiring a care manager. Because occasionally there will be somebody who says, I helped my aging parents through this, and now I want to help other people. And so they'll purport themselves to be a geriatric care manager. And it's like, well, just because you've done it with one family doesn't mean that you're ready to do it with a lot of families, right? Because this process is a very individualized process. And, I'm worried about those kinds of situations popping up, and they might be ready. But if you find somebody who's certified, you'll know that they have put in the number of years required to get experience, as well as the education required, as well as the ongoing education, right? So we have to go back to our certifying bodies and prove every year how many hours of education that we're getting to maintain our certificate. How do I select a geriatric care manager? So I pulled a list of questions, and I think we're going to make these slides available for everybody too. So don't feel like you've got to write it down, or maybe you could take a screenshot of it really quick if you wanted to. But I did write out a list of questions you can ask a geriatric care manager when you're shopping around. And one of the things to know is that, it's first really important for you to assess, like, what are your needs and what do you need out of a geriatric care manager before you go shopping for one. Because somebody who might be the best geriatric care manager for, the Smiths down the street might not be the best geriatric care manager for you. So what are the primary services provided by your agency or business? And does your company also provide home care services? So this question is tied to, there's a lot of home care agencies, right? So people who provide, or agencies that provide private duty caregivers in the home, CNAs to come into your home and provide home care services, that also employ geriatric care managers to help to help like give that extra level of support to their clients. But they're not the same as just a full out geriatric care manager. They might not provide the same level of service, individualized service as a geriatric care manager. So first starting with, what are the primary services provided by your agency? And do you also provide home care services? Will help you understand, like, is this a home care agency that also has some geriatric care management, or is it just geriatric care management? And sort of sorting that out for yourself. What are your professional credentials and what is your background and work experience? Again, my background is in mental health and clinical social work, not in nursing, right? And there are a couple of groups in Atlanta who have geriatric care managers who do have nursing backgrounds. So when a client calls me and we talk about what their needs are, if it's very medical in nature, I might say, you know what, I want you to know that I know a lot about the medical world, but I'm not a nurse. And we have some really great geriatric care managers in Atlanta who are nurses. Why don't you talk to one of them? So it could be really important for you to connect with somebody who has a nursing background if one of your issues is very medical in nature and navigating through the medical world. There's some of the clients I work with have bipolar disorder. And so it's very helpful for them that I have a background in mental health, so I can help them. Whenever there's a mental health crisis that comes up or is looking like it's going to come up, and we can intervene before the crisis happens. So knowing what, you're interviewing a geriatric care manager, understanding their professional credentials and their background and work experience could be really helpful for you. And again, there's not a one size fits all. I would never say what's best for a geriatric care manager to have a nurse background, or it's best for a geriatric care manager to have a social work background. I think it really depends on what the family and what the individual needs. Another question is, how long have you been providing aging life care management services? So how long have you been a geriatric care manager? How many aging life care professionals are in your agency? Are you a solo practitioner, which is fine, or is there a team of you guys? I think there's pros and cons to each of those situations. The agency I work for, there are 4 geriatric care managers on staff, so we're a very small agency, but we're large enough that we can cover when somebody else is sick or on vacation, but not so big that it's some, giant agency to try to navigate through. Here's another question I think is really important. Are you available for emergencies? So not all geriatric care managers are on call for their families 24/7. The agency I work for, we tend to specialize in families who need a lot of extensive support and ongoing support, and they need somebody who can be their emergency contact, but not all geriatric care managers operate that way. So again, is that something that you're looking for, or is it something that you're not looking for? Is that important for you and your family or not? And that's important to find out. How do you communicate with your clients and families? That'll be important. Does that match your needs, and will that give you what you need? What are your fees? Is there a fee for the initial consultation, and if so, how much? And can you provide me with references? So these are just some good questions to ask a geriatric care manager that you might interview. And again, just to make sure that they're going to meet your needs.
So Michelle, along those lines, one of the questions that came in the Q&A is geriatric care management covered by Medicare?
Yes, so that's a great question. So right now, geriatric care management services, unfortunately, are all private pay. It seems like Medicare and some of the private insurance companies are starting to offer care coordination services. And there is a new-ish billing code for care coordination that I think physician offices can use. But I think that tends to be more for, discussions about end-of-life planning and advanced directives, and not really the ongoing hands-on care management. And then some of the private insurance companies will offer you a care manager. But again, one thing to keep in mind is that for that insurance company, that's really about them containing their costs and keeping the crisis interventions and the acute services that they have to pay for, keeping that in a minimum. So, you know, are they really looking out for your interests, and are they going to be able to provide you with everything that you need or not? That was a really long way of saying, no, not really. So Medicare doesn't really pay for geriatric care management services. Some long-term care insurance policies will, though. And
Thank
Ashley,
you.
did you have any follow-up questions for that? Okay. And so I guess it's probably okay to talk about fees. In the Metro Atlanta area, what you're looking for paying for a geriatric care manager is anywhere between, I don't know, $125 to $150 an hour, I think is what the going rate is. And most of that's all paid on an hourly basis. Some agencies have you set up like an assessment at the beginning, and they'll just charge one lump sum for that assessment at the beginning. That could be several hundred dollars. So that's what the fees are looking like for a geriatric care manager in the Metro Atlanta area. And what if I can't afford a geriatric care manager? So that was perfect timing, Ashley, with your question, because it is expensive. And I know that when families call me, I mean, there's hardly ever a time, right, that a family calls me and they have a tremendous amount of disposable income that can be used to pay for my services, or pay for geriatric care manager services. So one of the things I always do first is make sure, like, find out what the client needs. And then I also find out, like, what are the other support systems around you, right? Like, are you already engaged with some providers that have social workers that you haven't plugged into yet? So Emory has a number of great social workers. Many of them, I mean, 3 of them are on our call with us today, who are just fantastic social workers. It's like, have you been connected with them yet to see if they're able to help get you what it is that you're looking for? Winship has amazing social workers. Hospice has social workers. And so I always say, like, you know, have you checked in with your providers and connected with their social workers on staff? Because if one of the things you're looking for is just a brief assessment, or just get pointed in the right direction, or facilitate a couple of conversations or family meetings, your social worker might be able to do that. I had a client recently who decided, even though they had a social worker through their primary care physician and a social worker available on site where they lived, they said to me, they were like, but Michelle, like, how many clients do you have? And I was like, 8. And he was like, yeah, it's worth paying for you, because I can get access to you much easier. Your caseload is not as large as what, you know, the other social workers are having to handle. And, you know, you can spend more time with our family. And so depending on what the needs are, you know, you might have social workers available to you, but, you know, they might not be able to be as comprehensive, as accessible, or as individualized as what you can get through a geriatric care manager. I also get to go with my clients to each of their doctor's appointments and do things for them that's very in depth, that social workers in a lot of other areas are not able to do for their clients, right? So, you know, the amount of, like, in-depth work I get to do with each of my clients is a lot more than what social workers in other fields or other areas are able to do.
Michelle, one of the questions that came in was, on average, how many hours a week do you spend with a client? And I bet that varies, but that was the question.
Yeah, that is a great question. So usually when clients first come on, you know, we're doing an assessment. And honestly, I mean, you can imagine, right? Like, families put off ever calling us until they're in an emergency or in some sort of crisis. So usually when a family, we first start working with a family, there's some sort of crisis that we need to get through. There's some sort of change that needs to take place that we need to help the family get through and put all the right things in place. So when a client first comes on, I would say it's like 4 to 10 hours in that first week doing the assessment and helping, you know, get through whatever crisis. And then once a client is stable, you know, I've got a handful of clients I see once a month for an hour. A couple I see just once every other week. Some I just see as needed. So it really does vary. And one of the things, because we're all very cognizant of how expensive our services are, one of the things we're always looking at too is there anything that I could be doing that I can actually outsource to somebody who charges less per hour. And so I'm always looking at like, when are we ready to start downgrading my interventions and widening our support system to include more providers that, are at a lower rate so that your money can last longer. And so is it time to get, a CNA or certified nursing assistant on board? Is it time to get, in-home care providers? Is it time to get like a companion involved who can do some of these things for you and help you make that money last as long as possible? So you're right, like it does vary quite a lot. The second thing on here underneath your social workers at Emory or through other providers, the second thing is on here is case managers through the Area Agency on Aging. And so, if you live in the Metro Atlanta area, their Area Agency on Aging is through the Atlanta Regional Commission, and they use the Empower line. So reaching out to the Empower line and, asking to be connected with any of the case managers that they can connect you with might be one way for you to get, sort of like geriatric care management services. Or you can call the county you live in, you can call their aging office directly and be asked to be put on a wait list for one of the case managers. I hear varying success stories about what that process is like and how easy it is to get connected with a case manager. But once you can get connected with somebody, that could be, a good bit of help. And then, of course, the Alzheimer's Association does have their 24/7 helpline. So again, doesn't really replace what a geriatric care manager can do, but it is a great source of support and help that's available 24/7. And I want to make sure people know about. Before I move on from this slide, I know that as we were planning this presentation, we really wanted to talk about the difference between what a geriatric care manager can do and what one of the social workers in the Emory clinics can do. So Ashley or Alice or Laura, is there anything that you guys want to add in here?
I think what Michelle and other geriatric care managers really bring to the table is more intensive services than what we can provide in clinic. And I think you've already spoken to it, but we can sort of help point people in the right direction. We may be able to get you started with where to go, but a geriatric care manager is really going to be able to work very closely with that family and sort of hold your hand through the process. So whereas I might be able to explain the placement process and sort of where to go, a geriatric care manager may help you tour places, may really be that person by your side or be a proxy. So maybe you can't go, your loved one's out of town, and you need a geriatric care manager to be helpful in sort of supporting you through things. So it really is a more high touch service than what we can provide.
I think that makes a lot of sense. And one of the things I value too is the ability to be able to collaborate with the social workers who are inside the clinic, because I know I call on Laura pretty often to say like, okay, we have a shared client and I need help navigating through this part of the Emory system. And then Laura can help get me pointed in the right direction. Or just be able to bounce off ideas when we have a shared client. And I could just say, I feel like I'm stuck with this issue. Like the family and I don't know what to do next. Like, what do you see from your point of view? And just being able to collaborate together, I think has been so helpful.
I think that speaks to what I was thinking as you were talking, as you were listing your excellent sort of things to think about when you're hiring a geriatric care manager. That one of the things that popped up in my head, and I'm not sure if I saw it or not, was how do you work with the other professionals on the client's care team? Because the more people I have to bounce challenging questions off of, the better. Like the more because it takes creativity, and the answer is there. This is not cookbook stuff that we're doing. This is how can we make this work?
Yeah, that's right.
So I think working with you, but absolutely I'm with for situations that are really, really complex. It's so wonderful to have a geriatric care manager, if that's an option, it's really a wonderful thing.
Yeah, I'm so glad that you guys are educating your community about what geriatric care managers can do. Because so often by the time people call us, they're like, I wish I had known about this years ago. Or I wish I'd known about this, you know, when we were taking care of my dad before he died years ago. And, you know, now they're taking care of their mom. And yeah, it can be a really great service. Alice, is there anything you wanted to add?
No, I did have a question to give you though, because I think it's helpful if you have a person maybe who is resistant to having somebody help them, but the family really needs that assistance and for you to be in there. How do you navigate that? How do you navigate being able to help the person if they don't want to necessarily get the help or don't feel like an issue?
It's a process. I'm thinking about the first client that Laura ever referred to me and or had referred the family to me. And one of my first jobs with her was for us to go to an IMCC appointment. And she slammed the door in my face and was screaming at me through the door. And I called Laura and I was like, we have to cancel our appointment. We're not going to make it today. And now, you know, it's been a year and a handful of months later, and I see this woman every single week, and she loves me with like open arms, and I love her, and I can get her to do things now that nobody else in her support system can do. So it's a process, and it's not always successful, but you just stick with it and keep trying. Each one of those, you know, like tactics that we use at our disposal when working with individuals and families, just to keep trying. So what I tell families is that I will be positively persistent, and I will just keep showing up and like be happy and engaging and friendly and supportive. And if they turn me away, then I will come back the next day. And if somebody has dementia, I know that they might not remember that I was just there yesterday, and maybe we're having a better day today, and we'll just keep trying. It's not always successful, especially when, you know, I'm thinking about my clients who have both dementia as well as a mental health diagnosis, a lot of paranoia, a lot of like resistant behavior or depression in there, you know, mixed into with some of their stuff. And then dementia keeps us from having the insight that we always need to knowing that we need help, right? That everybody else in the support team can see a support team is needed, supports are needed, help is needed, but a person living with dementia by the nature of their disease might not have that insight. And so working around that in ways, and trying to come in alongside of our clients and acknowledge, like, I'm not trying to take away your autonomy. I'm not trying to do anything for you that you can't do on your own. And the thing that I want the most is for your goals to be met. You know, so if you want to stay independent living in your home for as long as possible, like that's something I also want for you. But that means that we need to do X, Y, Z to make that happen, and just keep working at it.
Thanks. And I think that's what I wanted to communicate, well, to be communicated to everyone, is the fact that you can be that one who's persistent, that you have that time and that capability to keep putting that hands-on touch with them. So thank you for that.
Yeah, and the other thing that I bring to the table for families, well, that all of us professionals bring to the table, is that we don't have any of the family baggage that we're carrying into these interactions and engagements, right? So I tell my families all the time, like, when it comes to taking care of my mom, when that time comes, like, I'm gonna need a me to help me through that process, right? Because like there's even though my mom and I have a very strong relationship and I love her, like there's baggage there, right? And sometimes that baggage gets in the way of us being effective with our aging loved ones. And so sometimes it's yeah, I can say a lot about that, but I won't.
We have a really good question from that says, in the past, I've needed the help of a geriatric care manager in a crisis. Then the crisis subsides and the extra help isn't needed. It feels like it would be helpful to be a client so that when the crisis happens, I have someone to call on immediately. Is that possible?
Yeah, I have a client who signed on with me a year and a half ago. And that's all I am for them, is I'm just there in her back pocket. And, you know, we touch base every 4 to 6 weeks, you know, what's new, what's going on, anything I should know about. And I'm just there in her back pocket. That everything's going smooth right now, but she says, you know, they have very clear goals for their end of life wishes. And they said, I just want to make sure that I've got extra advocacy and support so that we can make sure that, you know, my mom gets everything she needs all the way through the end. And let's see. And I have another client who has mild cognitive impairment who has just signed on with me because she says, you know, one day I know that the need is going to be there. It's not today, probably won't be, you know, the next 3 or 4 months, maybe the next 2 or 3 years, you know, we don't know. But when that time does come, like, I want you to be there, and I want you to be my healthcare agent, and I want you to help, you know, the rest of my social support team, you know, navigate through this on my behalf. So absolutely. And then the question, I guess, was specifically about, like, sometimes there's a crisis and then things are steady for a while. Then there's another crisis and then it's steady. And yeah, I've got a handful of clients who just call me whenever the crisis comes, you know, and I jump in alongside them and help them through it. And then they're fine. And then we have another crisis and then we're fine. And yeah, that's definitely a way that you can have a relationship with a geriatric care manager.
We had another question, Michelle, about whether this presentation would be repeated, because they have some people that they want to see this presentation. Yeah. I think probably the best way for us to handle that is that we will send out to the attendee list. We will send out the slides after this is done. And we will probably get Michelle to come back sometime in 2022 to give a similar talk.
Yeah, anytime. Let me see if I have any more slides. Oh, that's where we were. Okay. So I'm going to actually, let me do this. There's one slide I skipped over in the beginning, this slide. So this slide is very important to me when we think about dementia caregiving and living with dementia, is that, you know, the person with dementia is right there in the center, and then we've got to have all these, like, appropriate supports around them, health professionals, personal care workers, family, friends, first responders, and that the goals are what's around the circle, right? And so, you know, the geriatric care manager is one of the health professionals who comes in the care provider team, just circling up with the other people who are there surrounding the person living with dementia. And so I think this is so important for us all to realize that living with dementia, or even caring for somebody living with dementia, is not something that you do in isolation, but it's got to be done with all these right pieces in place. And sorry, I skipped over that slide earlier. So I'm going to stop share now.
There's also another question that came in that asks, are there retainer fees involved when you're signed on, but services are not immediately needed?
You know what, every single agency does it differently. Our agency does not have a retainer fee. We recommend, and we try to work it out with our clients, that we do see them or engage with them at least once a month. And that's not really so much about the fee as it is about, you know, I want to make sure I know all the latest that's going on with you, so that when the crisis does happen, I'm adequately prepared to step in and help. So our agency doesn't require a fee to keep us on retainer, but we do try to make sure that we've got an actual appointment to meet with our client, either, you know, face to face or through Zoom or whatever, so that we can meet with them. Some agencies, I think, do have a retainer fee. I think it's been really reasonable, though, you know, like $100 a month. But each agency and each geriatric care manager will set that up differently.
Somebody would also like to know, is there a difference between a regular, quote unquote, geriatric care manager and one who specializes in Alzheimer's?
I don't know if anybody else can speak to that. I haven't seen anybody have a special designation. I think we all have different expertise and experience that maybe would lend us more towards being somebody who specializes in dementia or not. But I don't know if there's any special certification. And I would say probably most I would say probably almost all geriatric care managers have a specialty and expertise in dementia, just because it ends up being, you know, a large percentage of the clients that we work with are living with dementia. And then what ends up being more of a specialty, though, is like geriatric care managers who deal with people who have paranoia issues, or maybe have a tendency of being violent, and there might be some safety issues or substance abuse issues. So I think, you know, I think you'd have to like drill down to like different issues to find some real specialties. But Laura, do you know, or Alice, do y'all know if there are any other like special certifications or designations?
I don't know of any designations to search the Aging Life Care Management website to say, how do we narrow this down? But I think your point about most geriatric care managers have experience working with people living with dementia, because it is such a huge need in the community, and the prevalence is really high.
Okay. Yep.
I would say that that going back to the questions that you posted, Michelle, is really helpful. That when I'm looking for somebody, I want to know what their level of expertise is around the issues that are going on for my loved one. So I'm going to ask that question.
Yeah, and you know what, the other thing I found within the geriatric care community is that when one of us gets a referral, that the other, then we know that somebody else in the community is actually better at that we refer it out, right? Like there's a handful of geriatric care managers who've got a great specialty now, or developing a great specialty in traumatic brain injuries, you know, because they've gotten an opportunity to work very closely with the Shepherd Center. And so if somebody calls me and they're like, you know, when they mentioned traumatic brain injury, I'm like, I know who exactly to refer you to.
Michelle, thank you so much. Are there any other questions out there that folks are feeling reluctant to type in? Please put them in the Q&A. If not, it was a fantastic presentation. So thank you for giving your time today to us and sharing your expertise. We will get the slides out. Michelle has been generous enough to agree to share her slides, which is, thank you very much.
Absolutely.
And we will get those out hopefully by the end of today, if not by the end of today, by tomorrow. In March, mark your calendars now. Our next session will be Wednesday, March the 10th from 12 to 1, similar to this. And we will have Tracy Swartz coming from the driving evaluation group to talk all about driving evaluations, which is, as many people on the call know, always a hot topic. So she will be here to talk a little bit about what's involved in driving evaluations and to answer questions.
I just want to let people know, because I get the questions about whether they have to re-register. And so, yes, we are asking, we do send you the link when you register. So that gives us a chance to know who's going to be on the call, on the Zoom presentation. So yes, we'll let you know. We'll give you the email, the invite ahead of time about who's coming. But yes, to send me the information, I mean, that you'd like to be registered, so we can send you the link. It just helps us to keep track.
So there's a question in, will you send out reminders? The email goes out a week ahead of time to see if you're interested. And at that point you need to register. And we are not sending out reminders the day of. It's your responsibility to have it on your calendar and remember to sign on. We love doing this, and we're really excited that we get to do this. And we are doing this as an add-on after all of the other things that we are responsible to do. So we have to be really mindful about what we're taking on. So thanks y'all for bearing with us with that. If there are any other questions, please put them in the chat now. otherwise we will close up for today, and we will look forward to hopefully seeing many of you on March the 10th. And we'll see many of you before then. Okay, I did have one question after last time. Were we, the Emory social workers, available to folks who were not being treated through the integrated memory care clinic or the cognitive neurology program at Emory? And unfortunately, we are not available to folks who are not part of the Emory system. You're welcome to be part of the webinar, but we are not available to provide services outside of the patients that are part of our program. All right, but we have Michelle, so. All right, y'all. Thanks very much.
Bye. Thank you so much.
Thanks, Michelle.
Thank you.